everyone. My name is Joe Tibbs, and I'm the president of HAPevolve. And I have the distinct pleasure and opportunity to have Dr. Mark Simon with us today. Dr. Simon is the chief medical officer of one of HAPevolve's industry partners, OB Hospitalist Group. And we're here to talk a little bit about some of the interesting things that his organization does, helping hospital providers across Pennsylvania and beyond. Dr. Simon, before we jump in, can you give us a high-level overview about what OB Hospitalist Group is and what you guys do on a regular basis?
We are a medical network that spans across the United States, and we provide in-house or in-hospital OB coverage or obstetrical coverage for any patient that presents to that institution. So we're there to support the hospital in its goals and desires as it pertains to women's health. And we're there also to support the community physicians, midwives, and other clinicians to make sure that the best possible care is delivered to those patients.
So as you approach and work with hospitals and other health systems, what are the three major things that you want those organizations to know about your organization?
The first is in risk reduction. And having an OB hospitalist program can clearly reduce serious harm events, which could lead to malpractice risk or other untoward events. Additionally, our OB hospitalist programs can help improve quality outcomes. And then finally, one of the things that we're really supportive of is partnering with community physicians and/or midwives. And our goal is to work collaboratively with them and not in competition with them. We want to help them deliver the best possible care that they can for their patients.
Can you talk to us a little bit about what your approach is? What differentiates you as you work towards these pretty impressive and lofty goals?
When we work with a hospital partner to reduce risk, it's really a collaborative effort, and it spans the life cycle of the entire program. And what we do there is we want to make sure that we're hiring individuals who understand the role of an OB hospitalist, as well as they fit the culture of the particular institution that they're going to be practicing at. Not all institutions are the same. They have their own specific needs, and these physicians and midwives have to fit in at that location in order to be successful and ultimately to reduce risk. And so it's important that the physician and midwife understand that if they come on board to one of these programs, that's really what they're there to do.
Talk to me about the value of finding the right people in these positions, and how do you go about doing that with your clients?
The first thing we really want to do is understand what the program's goals and objectives are for women's and children's health, and what type of services are they offering today. Additionally, as you well know, some hospitals have residency programs. They could have a obstetrical and gynecology residency program, or they might have a family medicine residency program that is affiliated with that institution and does obstetrics. Those can play a role in the type of personalities that will fit in best. And so we glean that information from the hospital itself and their medical staff, the representatives of the medical staff, and then use that in our vetting process when we're identifying the right fit.
That's great. Can you talk to me a little bit about, anything that your programs do to help address, a pretty significant concern around, what to do, how to care for our caregivers?
Burnout in the clinician workforce is a serious issue, not only in Pennsylvania, but across the country. And it's definitely true within obstetrics as well. And so the OB hospitalists are there to help them with whatever the inpatient concerns those physicians might have. We're there to help them and make their lives as easy as we possibly can.
As you look at what the future holds, I don't know if your crystal ball still works. Mine kind of broke last March. But as you look to the future, what do you think hospital executives are going to be looking at in this space and beyond, from a workforce perspective, from a risk mitigation perspective? What are some of the impacts that you think we should all be thinking about as we move forward?
As we look forward in what's the future of OB, as it were. I do think that hospitals need to keep in mind that you have a ever-changing obstetrical workforce. And so it's going to be important for all of us, clinicians and hospitals together, to make sure that we're consistently delivering top-notch quality care, because you want to have the best possible outcomes for all of your patients. That's all of our goal. And if you do that, that will help you in so many ways with risk mitigation.
Dr. Simon, thank you again so much for your time today. It was a fantastic conversation where we touched base on workforce issues and some of the major pain points that I know not only hospitals and health systems in Pennsylvania are addressing right now, but also healthcare providers across the country. So thank you again for your time.
My pleasure to be here. Thank you.